Good evening and welcome to the Dental Community Resource. This is the late edition of our Tuesdays at 2, coming back to you after our 4-month absence as we all re-immersed ourselves into our respective practices. I hope you're well and your families and staff and teams have maintained a sense of health during this very challenging 4 months that we've experienced so far. We're coming back to you today in the spirit of reconnecting and wanting to take stock of some new guidance that has been made available to us in the province of Ontario. I'm assuming that the books beside your bed stand look something like this, as we all pine for days when we can return to visions of travel, getting away and escaping from the reality that some of us are having to face, or most of us are having to face. We left off in early June, speaking of this new era, practicing dentistry during the COVID pandemic. And before we get started into some of the details that have been forthcoming in these last few weeks, I'd like to welcome back Steve and Manor. I'd also like to recognize and thank all the members of our Dental Community Resource team who continue to support us and provide us with information that we're bringing to you today. So I'll start off with you, Steve. Why don't you share with us, if you may, how you have adapted in these last 4 months?
Good evening, everybody, and thank you for the opportunity to meet with you all again. I was mentioning to John and Minor that period between March and June was probably the darkest period in dentistry, and for many of us, financially and personally as well, was not a wonderful time. And one of the bright spots from all of that was the opportunity to meet with all of you, and the feedback that we got and the sense of community that I felt was really incredible. It was one of the highlights of that period of time. And I do appreciate all of you that reached out to us and participated. We had opened and Minor, John, and I had decided to have a community resource to really try to unite the dental community in our day-to-day frustrations about 1.5 years ago. And during the pandemic, I really felt that there was a connection between the entire dental community that was with us. So I thank you all for that. John, you asked me to describe our adaptation in the last 4 months since we were given the ability to go back to practice in early June. And for us, we have a fairly large practice and a fairly large staff, and the responsibility of keeping them safe was, I felt, almost an unbearable burden. The patients, I understood that by following all the guidelines and the PPE, we would be, I thought we would be okay in keeping our patients safe. But my staff, it's hard to hold them apart. It's hard to keep them separated during breaks and lunches, and I really felt that and took that responsibility seriously. And despite a lot of pressure to do otherwise, I've limited the amount of staff that is returned. I've really made the practice considerably smaller than it was before. We are not providing this same number of services that we did, and we adapted a lot of our protocols, a lot of our clinical protocols to reduce the number of inpatient visits that were required, to just reduce the total number of people that enter and exit this practice every day. All of our administrative team, we somehow, using technology, were able to switch all of that to remote. So none of them are in the office, despite some serious frustrations and objections and lots of pressure to go back to the way we were. We are far from the way we were, but we're adapting. And we are, we have a large waiting area or reception area that we do not utilize, that is empty, and patients come in one at a time. We see them, and we've reduced the number of providers that we offer. So we've managed to adapt, and I'm not unhappy with the adaptation. But it's been really, and I'm proud of the people that have come back to work, taking it serious, and I feel safe here, and looking forward to this when it all ends and going back to a different kind of reality. How about you, Minor?
So, hello everyone. Thank you, Steve. What a pleasure it is to be back. I hope everyone's well. So, in terms of adapting, I mean, I agree. These have been, holy cow, some stressful months. I mean, I've adapted by going on trips around the world. I just came back. I'm just joking. We only wish. But no, more seriously, we've really adapted by, I would say, myself and my staff having systems in place and having people with delegating certain responsibilities, being on top of PPE and supplies. Essentially, I've adapted by having our practice be very proactive, expecting the worst, assuming that in 1 month's time, there won't be any more gloves or maybe anesthetics or whatever you think, I've always had plenty of. No, be prepared. And it's not a matter of hoarding. We've adapted by stocking up enough for the worst case scenario for a number of months, whereas in the past, we wouldn't have had to. We've adapted by screening patients far more carefully, more practically. We don't necessarily recall every patient or certain patients like we have in the past, just like public health is saying, and rightfully so recommending, try and minimize the number of people in your office and minimize the number of visits people have to make outside of their safe zones in their homes. We've adapted our treatments even. If a patient comes in, for instance, for a consultation and turns out they need treatment, somehow we are prepared to treat them then, and then right away call the next patient saying, I'm sorry, but we're going to be a few minutes behind, because we don't want to have those patients exit their homes or come into our offices multiple times. This is straight from public health. This is a really important thing for minimizing the risk of COVID in our practice and to our patients and our staff. So it's things like this, being proactive. Instead of complaining, just expect the worst, change the systems in your office. And after a while, that's it. That's just the way it is. You get used to it. And by now we're used to it. There's less stress physically and emotionally, I find, in our office now than there was a few months ago, because we've never let our guard down. And now that's just what we're used to, no matter the situation.
If I can add to that, in our office, we've adapted by following the Ministry of Health guidance to try to, once again, like both Steve and Manor have described, minimize the number of encounters, number of times patients have to leave their homes to come to our office. So we've adopted teledentistry for meeting patients and conducting virtual consultations, at least as a first step in the process. And that's been very well received by patients who are very accustomed now to meeting their doctors or the medical community virtually. On the educational front, Genesis, which is our educational arm, has regrettably, but wisely, I think, and prudently had to postpone all in-person courses that we had part of our academic calendar for the fall of 2020, winter of 2021, and we're hoping to be able to meet up again in person in the spring. So as you can see, and these are just small examples or some examples of the adaptation that's gone on, and I'm sure all of you have had to do so, because that's just been the reality of patient care in this COVID era. I'd like to zero in on why we're gathering again this evening. We left you where the arrow marks, where we were in the downswing of the first wave, and regrettably, but quite frankly, quite predictably, you don't have to, this does not require a lot of imagination to think that a second wave could come. And it has indeed come, and this is where we're at today. But there's a lot that has changed. And when all of us received that email back on March 15th, advising us that we needed to shut down the following day, none of us were really prepared, definitely not in terms of on an organizational level or emotionally, to deal with the consequences with so many unknowns. This time around, having had that experience, we at least are embarking on managing and the challenges of a second wave with some experience under our belt. But the numbers are quite staggering, as we've seen, and we don't have to look, we can look outside of our own area, our own country, to see how this is affecting the world on a global level. When we left off on our sign-off back in June, we had talked about the importance of getting ready, and sure enough, we were getting ready in light of the guidance we were waiting for that the RCDSO provided for us back on May 25th. So what has transpired in these last 4 months? This is the summary here on the slide, showing us the communication that we've received in these last 4 months. And I think what I'd really like to focus on this evening with Steve and Manor is particularly what's come to us in September, which was a critical document on September 3rd, which is the amended guidance on managing infection risks. And then in these last few weeks, just before Thanksgiving, and then again as of October 19th, this whole idea of the province being identifying hot zones or hot spots within the province of Ontario, where the city of Toronto, Ottawa, and the regions of Peel and now York have been added to this list. And we're going to deconstruct this for you like we've done in the past, just as a reminder of understanding. So on October 15th, we received this update in response to the provincial government's announcement of new regional restrictions. And this is, again, this novel idea where the province wasn't being painted with one brush, but specific areas were have been identified with changes to the restrictions that were made enforced for the public to follow. And these areas, as I've said, have indeed been identified. What's important, I think, for us, obviously, as dentists, is to look at this in the context of the implications for dentistry. And Manor, maybe you can comment a little bit about your take on this highlighted aspect of this paragraph.
Yeah, thank you, John. When I saw this, that the new implications for dentistry mean that they do not alter the scope of dental care, I have to say I was very relieved, and I'm sure many of you were very relieved too, because the impression I got just days earlier when, or even weeks earlier, when the public health officer of Ontario said, now we, for these areas where there's higher numbers of COVID cases, that you're going to have to treat people as if they're screened positive. To me, that reminded me of the days a few months ago when we're only able to do emergency care or urgent care. And so to be able to still continue ahead with our scope of care was a huge relief, while keeping in mind that things could change in a heartbeat. We don't know which way this will go. So it was a relief, but it's you still have to be exceptionally cautious with things.
Thank you. The other question that was posed, obviously, to all of us is, how should we adjust our practice? And this is relevant for those of you who practice in these hot zones, as well as those who are outside of these hot zones, but who have a keen appreciation that if the trends continue, the second wave is likely to affect more and more regions in the province of Ontario. So we have been advised that as dentists in Ontario, we must continue to follow the September 3rd document, which we will touch upon, and that the college strongly recommends that we take the following additional steps. Number one, that we avoid performing AGPs whenever possible. And number two, that when AGPs have to be performed, that we adhere to the enhanced precautions, assuming that patients have screened or tested positive for COVID-19. And this, I think, is a really important point to focus on as we prepare ourselves for everyday practice.
If I may, John,
Yes,
as you're reading this, really the way I see it is that whole controversy that there has been in previous months, especially between the hygiene college and our college, about are we really practicing following universal precautions or selective universal precautions, depending on whether the patient is screened positive for COVID or not. This pretty much takes care of it all, at least in the hot zones. To me, it means finally, at least in these areas, we are practicing true universal precautions, period. We're assuming everyone has HIV, everyone has COVID, so on and so forth. So at least it throws that controversy out the window. And to me, it sort of gives me some, less stress, because I don't have to be selective. And what if someone thinks this way or that way? That's it. Everyone is equal. We're on guard for everyone.
Yeah, I think that's a really valid point. I think that the concept of universal precautions is so familiar to all of us who practice dentistry. The precautions that have been identified to us in light of the fact that we're now taking universal precautions in these hot zones are summarized in these 8 points. And as we've always done in the past, we'd like to touch upon them just as a friendly reminder of the things that we should be aware of and the things that we should be implementing in our everyday practice. So this is the document that was referenced that came out on September 3rd. And once again, it focused on the upside down pyramid that we had introduced to the DCR back in the early spring, focusing on the things that we could actually control to help mitigate the risks of the spread of COVID-19 during this pandemic. The reminder, as has been mentioned and Manor touched upon, the implications to dentistry is that we are indeed, following the Ministry of Health guidance, permitted to provide in-person care for all deferred, non-essential and elective services, in addition to emergency and urgent care. So this should be a source of comfort to all of us, quite different from where we were at back in March, April, and May. When it comes to the provision of dental care, there are specific things that we start our day with, and that is the screening process. So we've relied very heavily prior to the breakdown of the province into hot zones of ideally and preferably treating patients who indeed screen negative. In the hot zones now, just to repeat, we're assuming that everybody is actually, although they may screen negative, may indeed be COVID positive. And the guidance from a questionnaire standpoint hasn't changed. It was updated on June 11th, but the Ministry of Health questionnaire, COVID questionnaire, has indeed remained the same since then.
John,
yes.
If I can interrupt for a sec.
Of course.
I noticed the wording of the document this time. The words strongly recommended that we adapt these new protocols as opposed to mandated that we do. Strongly recommended. And I know that there's some controversy about that. And I thought maybe we want to just discuss it and how we all feel about those words. For me, the word strongly recommended, as a business owner, as a healthcare provider, it means that there's a liability to everything we do. We're responsible for the staff around us, for the profession in general. We all affect each other. Outbreaks in dental communities are bad for all of us. To me, strongly recommended is the same almost as mandated. As somebody who has to make decisions, I'm trusted or entrusted. I'm assuming that the college cannot mandate decisions, as we're entrusted at some point to use our best judgment. But to me, strongly recommended, it takes the burden. If I follow the strong recommendations of our governing body, it takes the burden of responsibility off my shoulders. At the least, if there's an adverse outcome, I can say I did everything that I was strongly recommended to do. And I know that there's been some controversy within the community as what that means. And so I think, in my opinion anyway, I would like to try to, as much as possible, or all the way if possible, follow those strong recommendations. And I advise the rest of us to be continually making decisions and staying safe, because it does affect each of us. So I just like Manor or John, if you could comment on your take on that.
No, Steve, I couldn't have put it any better. The way I practice is assuming, if heaven forbid something happens in my practice and I get a knock on the door from the college, or even worse, from public health, how do I explain things to them? So if I've done everything that I could and should to the high standards, assuming everyone is COVID positive, then hey, stuff still happens. Listen, it's a matter of sometimes luck, as careful as we might be. But yeah, I agree. What this could do to your practice, to your business, to our reputation is devastating. And so I do practice as if it means, no, we have to do this. These are very strong recommendations they're making. It's not if possible sort of wording like we used to have a few months ago anymore. So I'm with you, Steve.
Yeah, and I would echo what the two of you have said. I think it's also worth reminding our community that these are all time dependent. So the second wave, just like the first wave, will come to an end. I mean, there's obviously discussion about a third wave and beyond. But you know, the sense that we have to remind ourselves of is that this is not the way it's going to be forever. I think it's just an expectation that we have to ride this out and to do it prudently and carefully, as the two of you are suggesting. So thank you. I think that's a point well taken. Okay, just going back to the actual items that we were told to look out for. So a reminder again, in an attempt to protect ourselves primarily, the use of an oral rinse. We were reminded to, if this is not part of our routine practice, to incorporate it, use extraoral radiographs whenever possible. We should avoid, again, as we've just been discussing, AGPs whenever possible, using the lowest aerosol generating options when necessary. When it comes to preparing our operatories, with the assumption, again, we're focusing on the details regarding these hot zones, but the anticipation is that these hot zones will increase in number as the second wave continues to strike the province. Is that for these patients, we need to be cognizant of the need for floor-to-ceiling walls and the door or some form of barrier. When it comes to PPE, assuming patients are indeed positive, an N95 respirator that's been fit tested and seal checked is an integral part of our protection, as well as gloves, eye protection and face shield, and a protective gown. We also need to be sensitive to the use of rubber dam and high volume suction when we're providing AGPs on patients who've screened or we assume are positive. And very importantly, because this really affects the flow of patient care, the numbers of patients we treat, a keen appreciation for fallow time, for the necessary fallow period of an operatory following an aerosol generating procedure. We need to be reminded that the operatories need to be closed and left empty for the prescribed fallow time before being able to go in and have it appropriately sanitized. And this was, again, something that was brought to our attention just recently from the September 3rd document, which is a CDC document, looking at this whole conversation, all these new terms that we were introduced to this past spring on air changes per hour in our respective operatories, and then the need to consult with HVAC professional people to assess the HVAC system currently existing in our buildings. And we were also given some options to improve the cleaning of the air in our operatories with specific guidance provided in this document. We're also told that we're assuming a rate of 2 exchanges per hour if it's unknown, and for us to adhere to a minimum fallow time of 3 hours following an AGP, which is obviously not sustainable for practices, and that's why all of us these last several months have done what we had to do to be able to fall within a much more reasonable fallow time to allow us to practice safely, but also efficiently and effectively. One other item that we'd like to bring to your attention, which may have gotten lost in the excellent communication that I must say, and I think my colleague Stephen Menor would agree to, the ODA has provided us with in these last several months, is page 9 of the most recent toolkits, which is some guidance, a practical algorithm on how we manage those early morning calls that you may have already received from staff, particularly now that children are back in school, who wake up with a sore throat, a runny nose. This is a very useful guidance, and it was actually Menor who brought this to my attention. And Menor, maybe you can comment a little bit about it.
Yeah, thank you. So this one algorithm is probably the thing I've been waiting for more than anything else from any credible, respected organization. And I know there've been a lot of complaints in the beginning, actually a lot of complaints in general. I'm just tired of, I have no energy for complaints. Just let's deal with it. But this is one of those things where a lot of people were complaining about the ODA, and I really have to take my hat off to them right now with their toolkit with respect to our staff and patients and our practice. And this one page is what I've been waiting for, because I've actually reached out to public health a number of times about scenarios. What if this? What if that happens? What if that? And I have to say, multiple times, multiple phone calls, I can never get a straight answer. This is the thing that we should all have in our pocket every morning. Like John says, if your staff member calls you at 6 a.m. saying, you know, my throat feels like this, or I may have been in contact with someone who maybe has COVID, or someone who actually has tested positive to COVID, what should I do? Before you automatically say, don't come to work, because for practices, that could be devastating. Staffing is already an issue. You can't afford to be short of staff. And believe it or not, if you follow this algorithm, you might be very surprised with what we should do and what we could do. A lot depends on, well, if you've been in contact with someone who was positive or suspected to be positive, well, how many minutes were you in contact with him? Were you wearing a mask or not wearing a mask? So on and so forth. And then you'll get the answer you need to, do you come back to work or not? And you'll be very surprised. So keep this toolkit really close to you. Keep this one page really close to you. So John, thank you for including this. But this is very practical to practices that need to be functioning. We need our staff. We need to know what to do, and we need to have answers right away for our staff versus saying, well, let me call public health and get an answer maybe in a couple hours when I have a practice to run. So thank you for including this. And I got to thank the ODA for this. Make use of that toolkit. Please go over every page, but especially this one.
Yeah, and I think there's been a steady stream of information coming our way, and I'm glad that we're highlighting this because this is very practical. When we look at the more information about the respective areas within the province as the second wave continues to present itself to us, it's going to be critical that we have a sense of what's happening in our own backyard. And the RCDSO has provided us with several links to get a sense of what's the state of the disease, what's the extent of the disease in our respective areas. So please take a look at this if you're unsure. Obviously, the 4 identified areas, Toronto, Ottawa, Peel, and York, are very clearly spelled out to us. But as Steve said, I think very appropriately back in the spring, it's the virus that's going to dictate the course of our lives when it comes to practice, and it's also going to be affecting which areas are actually deemed to be these hot zones. When it comes to the length of time that these recommendations are going to remain in effect, it's very hard to tell. I think, and Steve mentioned this previously in conversations that we've had, is that it's the Ministry of Health ultimately that is going to be deciding in providing guidance to the respective colleges throughout the province. And we just don't know. I mean, I think if we all continue to do our part, the ask is not so big to wear a mask, physically distance, wash our hands, which are now just sort of so routine in our everyday life. It's going to require a collective effort. And we have felt at the DCR that in our own small way as a community, we've been very sort of insistent on us abiding and following these rules, because we all obviously are beneficiaries of it if indeed we're able to do this. So, hats off to you as you continue to instruct not only your families, but your respective teams in your offices.
John?
Yes.
I'm with regard to the last 4 months, one of the things that I'm really quite surprised, or pleasantly surprised, is that the dental community has really not contributed to any major outbreaks. And it was, remember when we met back in June, it was our parting advice to everybody, like, be super careful because we are all connected in this. And now just in the last little while, in the last week, as the numbers are creeping up everywhere, there's been 1 or 2, certainly not widespread by any means, but 1 or 2 that I'm aware of that have crept up in the dental office, whether it's staff or patients, we're not clear. And that certainly could be devastating to the reputation of that individual practice, and certainly, without question, devastating to the rest of us as patients read this and decide to postpone or cancel their own care. But I think when you're talking about how long will these recommendations be in effect, we need to first congratulate ourselves on doing so well for the last 4 months, but understand that the hard work is probably coming now. It's not the time to get, what do they call it? COVID fatigue, where we're just tired of all of this. It's the flu season. It's the increased numbers. It's the time right now that we are at huge risk again. And I know that this is cumbersome, and all of us, even in our own internal dialogue at my practice, look at this as some kind of punishment of some sort. But it truly is the recipe for us to survive this. And I don't mean to sound like I think that all of us have to change the way we think. And yes, that we've added some more restrictions into our daily life and into our practice. But the need for those restrictions is incredible, and the risk for not following them is even more so. So when we look at how long this will last, and whether it's in our area or not in our area, it's incumbent upon us all to be super diligent in trying to really prevent outbreaks within a dental office.
Yeah, thanks, Steve. I think this really sort of fosters our sense of community because we're all so connected to anything that makes the news. And this is a good segue to our own interpretation of this updated guidance. We had used this a metaphor before of traffic lights back in the spring of where we were at, and we definitely started off with a hard red in those early months. And I'll pass on the floor to Manor. If you can start off by telling us, how do you interpret this updated guidance, Manor?
Yeah, so I see where we're at now as being yellow. We're now practicing very cautiously, and just like Steve was saying, with a lot of vigilance, can't let your guard down. But it's reached a point where, I would hope that most of us, maybe all of us, have been practicing with so much vigilance now for so long, as it seems, that it really does become the norm. It's like it's as if we're at the new world green. In other words, remember decades ago when HIV came out, no one even used gloves. Who would use gloves on their hands now? Like, how could you practice without gloves? Well, that became the new world green back then. That's where we are now, but with an even higher standard of care and safety. But keep in mind, this could easily, in a heartbeat, go back to red. Don't forget what happened just recently, just west of Toronto, in a spin class, and how that literally overnight changed what the public, the chief medical officer of Ontario was saying, and what public health was saying and viewing, and their perception of gyms. Overnight, it's changed. The same thing could happen. I hope not. But it could happen to dentistry. And so it could easily go back to where it was. And also, we're at the mercy of the virus. So, we're at a cautious green. We're getting used to it. We've got our systems in place. It's the new world green, but oh my God, it could easily go back to red. Not to sound negative, but just do your part, and hopefully we'll stay at that comfortable yellowish kind of zone.
What about you, Steve?
Yeah, as I was just saying, to me, it's there's a big difference between red and yellow. In red, you're going nowhere. We're stopped. In yellow, we are working our way around the impasse, and we are still getting to our destination. Maybe a little bit slower, maybe not as efficiently as we got there before, but we're still moving. And I think it's imperative for us to try to keep the light on yellow while this virus is around. Green is easy to live through. It's this yellow that's the challenge. And I think that we're on a very strong yellow right now. And I think that we can still navigate and still make a living, but it's getting challenging. But we can't run this light. We can't just throw caution into the wind, or we'll have an issue. So I'm seeing it as a very strong yellow.
Yeah, and I liked your analogy you had mentioned in the conversation you and I had about it's like driving through a school zone, right? It's really being on guard. I think that's an easy visual for all of us to appreciate. What I'd like to add too, for those of us who practice outside of the hot zones, one of the challenges that we faced is that in the absence of incidents of disease, it's hard sometimes for patients to really even appreciate that this is something they should be concerned about because they've just been so removed from it. And that's a constant conversation that's being had because, as we've described, I think repeatedly this evening, it can change so rapidly, and we've seen evidence of that in some of the areas where we've had dental offices involved or related to COVID spread. Although the details still missing. Yes.
If I can talk about patient response for a moment. It's something we didn't touch on. We only talked about ourselves here. For my experience, I'm in one of the hot zones, and my experience and our precautions have really affected the patient experience. The patients are out in our parking lot for the most part. Nobody's coming into the facility. It is more inconvenient, but overwhelmingly, the response from the patients has been phenomenal. They appreciate the precautions. They appreciate the fact that they don't see another patient when they're in this clinic. I've had nothing but, not only personally when they're here, but even thank you emails when they're back, how safe they felt, how some of them even use that as a reason to bring their elderly parents to have, or ask if we can see their elderly parents. This abundance of caution that we've maintained throughout has been, and I'd love to hear both of your reactions to this, but the patient response has been incredible, something that I think that we should share. And Menor, I'm curious about yours.
Yeah, it's been actually the very same scenario. Patients really do appreciate how we are. We don't want any patients crossing paths. We're so efficient when we do. They understand if we ask them to wait outside. It's a pleasant. I didn't know what objections I may get from some people, and it's been very pleasant to see that. And I'm glad they're appreciating just how careful we are, and staff appreciate seeing that all the work they're doing and all the protocols they're following are putting them at ease. And all that together also puts the staff at ease. So I know we're talking about patients, Steve, you're right, or not just about ourselves, but our staff. To me, that's been so important to make sure my staff are comfortable and that they are safe, and that they feel and they perceive that they're safe also in coming to work. And fortunately, so far it's been great that way. And no one is letting their guard down. And if you think that they are, you got to keep reminding them regardless of what zone you're at. But don't forget, I agree, your patients' perceptions and safety, but also your staff's safety, and making sure that you talk to them and communicate with them and make sure that they're comfortable still coming into work. So yeah, no, we've had no objections. It's been rare that we've had anyone coming and saying, I don't want to wear a mask. And, you know, we're very clear in that. No mask, you're not being seen, unless you got a medical record saying that you cannot wear a mask. It's been very rare. That's been my one thing that I've been kind of maybe worried about in the back of my mind in terms of turning into a scene in the office. No issues there. So yeah, this is the new world green that I see. Staff, patients, offices, protocols, this is where we're at, and we move forward carefully.
I think we can all relate to this the 6-month sort of wall that if not all of us, most of us hit going through this, and personally, our staff and our patients. But I would echo your sentiments, Stephen Menor, that patients who obviously we're ultimately here to take care of have been very appreciative, overwhelmingly appreciative of how cautious we've been and how attentive we've been to their safety. So yeah, I think that's going to be our legacy, and that's collectively what we should be striving for sure. Okay, as we come to a conclusion here this evening, I just want to remind you that we will continue to provide information to you on our site, but we also want to share with you something new that we're working on. This dental community resource that Steve Menor and I started about 18 months ago, back in March of 2019, was really conceived to provide the dental community with an opportunity to gather. We hosted a series of information nights. We have a facility that was built specifically, lent itself to the gathering of lots of dentists, where we could grab a bite to eat and spend a couple of hours on a work night, basically being introduced to topics that would help enhance our everyday practice, make us aware of things that maybe we weren't in touch with. We started out with this vision and mission back then, and were able to sustain it for almost a year till COVID hit. And then we felt it's incumbent on us to switch gears and bring you the Tuesdays at 2, which we were very happy to do, and happy to see that it was well received by our community. In light of various conversations that we've had and continue to have through our focus groups, it's been brought to our attention that there's another need that dentists are seeking. In the absence of the ability of the collegial social gatherings that we're used to in dental continuing education, that has been significantly curtailed with COVID-19, we are launching our DCR mentorship. This is an opportunity for us to provide you with insight based on our experience, to provide the support that you need for your day-to-day dental practices. We're really excited about this new venture because I think it comes at a time where we can leverage the technology that exists for us to be able to continue in the spirit of fostering a collegial sense of community that we really enjoy and be very happy to be a part of to you without having to gather in person. And I'm going to ask Steve and Menor to talk a little bit about their view of what has been sort of behind the genesis of our DCR mentorship. So Steve, I'll pass it on to you.
So again, through the focus groups and through our relationships with referring doctors and the dental community, there's been a demand, and we've been trying to figure out a way to try to address this, where many of you would like to take on more complex cases and need just some help with the diagnostic sides, with the advice from people with experience in different aspects of dentistry. And we've been trying to formalize this in a way, and it's been difficult up until I think the last few years, when so many changes in the technology side of dentistry and the imaging side of dentistry really allows us the opportunity to share patients virtually. So I think that with John and Minor, the three of us really came up with this idea that those of you who have patients that you would be interested in treating that require a little bit more complex treatment planning, if you can somehow contact us, and we'll be contacting you in the next little while with the details of how we can make this work. We'll put this together virtually, and instead of meeting with you privately to go through the case, we'll share this with the entire community. So we'll be looking forward to doing that. And John, you'll formalize whether it will be, the timeframes and how we're going to do this. But it's really something we're excited about, something that we've been talking about for a long time, that we can help give back some of the expertise and experience that we have in making yourself feel comfortable about outcomes treating your patients. Minor?
Yeah, I am very excited about this. We can't wait. I can't wait to actually do this together with the audience. And what I want to stress here is that we're here to help you practice this dentistry on your patients, but with our sort of support or mentorship in the background. So like Steve, like you were saying, it's all about helping you, the audience, or the doctor that's presenting a case, but in a very humble, down-to-earth kind of a scene. Again, we've all been there. We've all faced our own scenarios, good, bad, whatever. So never be shy to share a case. It'll all be done in a really comfortable, humble way. But what I also want to stress here is that this is going to be done where we diagnose and help you treatment plan and manage this case, but in a very timely fashion. What I mean timely is that saying, how do you manage this case and treatment plan this case in the COVID era? Because things are different now, the way we see it, than they were before COVID. Should you do it, certain things, 1 appointment, 2 appointments? How should you screen them? What should you do before, during, after, all while keeping in mind COVID regulations and guidelines and your patient's well-being and so on and so forth, while still being able to practice yourself on this patient. So I am incredibly excited about this, and I look forward to this tremendously.
Thank you, guys. The logistics, the details, the structure of this DCR mentorship program that we're launching will be forthcoming in the next week or so. We'd like to host our first event at the end of November or first week of December at the latest. And the goal here will be for 1 or 2 of you to have cases that we will present, we will discuss, have a panel discussion, and then members of the dental community resource will be in attendance, being able to ask questions. There's lots of obviously scope for learning from any respective case. So we're excited to do this. It seems like a real natural fit for this group and for us to give back to the DCR. With that, I'd like to, on behalf of Steve and Minor and our entire team, thank you once again for joining us. Be safe and stay well. Take care. Thank you.
Thank you, everyone. Bye-bye.